I'm just really delighted to introduce Dr. Leila Aflatoony to all of us at the School of Nursing. Dr. Aflatoony is the design studio director for the Emory Roybal Center for Dementia Caregiving Mastery. Just by way of orientation, the center is one of 4 national centers that's devoted to providing support for pilot projects to enhance the care of persons living with dementia. And ours is particularly focused on caregiving mastery. Dr. Aflatoony is an assistant professor at Georgia Tech in the School of Industrial Design. She has her PhD in interactive arts and technology from Simon Fraser University. And my recommendation is to visit British Columbia as soon and as often as possible. She's also a postdoctoral fellow from the University of British Columbia. I think it's really important to note that Dr. Aflatoony's participation in our center is part of actually a long-standing kind of affiliation that we've had with the School of Industrial Design and School of Architecture at Georgia Tech for many, many years. Our own faculty have participated. Georgia Tech faculty participate with us and have been instrumental, for example, in development of the Cognitive Empowerment Center, a center for people living with MCI. So this is not a unique thing, but really an important continuation of a really important collaboration. So Leila, if you are ready to go, I'm again welcome and thank you so much for presenting this seminar for us.
Of course, it's a pleasure. Thanks for the invitation and thanks for the great introduction, Ken. Thanks a lot. So hello everyone again. So I keep the introduction short since Ken did a great job on that. So I just would like to continue with the main topic of this talk, which is how we use design thinking to understand and develop and understand interventions for dementia caregiving mastery. And so I try to talk about everything but specific stages and, give you some information on how we did, what we did, but also how we did it. With that, okay. So what is design thinking? As perhaps it's clear from the name of it, it's a tool or an approach that we use as designers in our practice to basically to come up with innovative information, interventions and make sure that we come up with a solution or intervention that is human-centered, human-centric, but also innovative. And so the process helps us to, understand not only the problem, but also define what is the solution. But the most important thing is that I would like to emphasize on is that we are focusing on solving the right problem. So we go through all this process of exploring or defining the problem and finding the solution, but we want to make sure that it is the right solution that we are focusing on. So we use different toolkits, designer toolkits, such as brainstorming, different ways to explore the problems and solution. But the most important key, I would say, criteria here is to make sure that we empathize with users and that we, through different techniques that we use, we understand the true need that they have. So that is also talking about the right problem and in fact the process. We use a lot of divergent thinking and convergent thinking that is kind of somehow has some overlap with another framework that we use Double Diamond, you know, from British Council. It's a framework that has some good overlap with design thinking. And the idea is like simply through two main steps or stages, we try to identify specific problem and specific solution, but in each stage, right? So we, for example, to identify a specific problem, we use divergent thinking to come up with a list of problems and then narrow it down to one specific problem, again, through brainstorming and through going through this comprehensive and concrete process of prioritizing what is the most important problem or urgent problem to focus on. Then similarly, like in the next phase, which is basically the goal is to identify the best intervention or solution, we use divergent thinking and convergent thinking again to ideate a list of solutions and then focus on and think about, brainstorm, and through different techniques that we can use, identify what is the most important solution. So focus on that. So then talking about design thinking in healthcare in general, there are many studies that showed how design thinking can facilitate improvements in patient care in general and providing better patient care, and how this can support with understanding the true need of patients, their family, and provide a healthcare that is satisfactory for I would say not only patient and family, but also how you know, care providers also make sure that you know, they're happy about the process and to make sure that the care that they provide is satisfactory. So it's kind of supporting in a way everyone and through different ways, for example, by creating greater empathy for the needs of the community. Through it helps with understanding the problem and in general with the goal of making sure that the intervention or solution is satisfactory. So another thing that I wanted to emphasize on is that design thinking is collaborative. And of course, there are studies in general on applying design thinking in non-design you know, areas. And then the goal is to come up with an innovative solution or intervention through collaboration. So talking about what we did, like we conducted 3 workshops or webinars. And what we did was in line with basically the goal of Royal Center with this central key idea of how we can develop an intervention that promote a greater sense of dementia caregiving mastery. So that was the central goal that we had. And then we used design thinking to specifically focus on or, you know, basically connect with family caregivers, to empathize with them and understand their challenges. But also we wanted to generate novel interventions. What is the most important problem to focus on, and what are the solutions to those problems, and also validate the solution with caregivers. So we went through another phase to literally evaluate if these interventions are the most critical or is what caregivers would like us to focus on. We considered this central case study of integrated memory care clinic that Dr. Clevenger, she's the director of the clinic. And so since all family caregivers were familiar with this clinic, we asked question, or we considered as a central case study to kind of facilitate the conversation around the service that they received, or how, for example, can the primary care for them be improved? How can providers better support caregivers in providing primary care? How can the clinic experience be improved for caregivers? And it really was helpful to have this case study to just focus on the experiences that they they got in the past, and then thinking about the problems, not too broadly, but like basically focus on the care that received from the clinic. So talking about design thinking stages, so there are 5 different stages in design thinking: empathize, define, ideate, prototype, and test. So the empathize phase, the first stage is to really all about understanding users and their needs. It's really common to use different techniques such as interview, focus group, more participatory approaches to understanding the problem, observation. Depending again on the type of project we're focusing on, we can use any of these, I would say, research techniques to collect information. But the central goal here is to develop a deep understanding of the challenges that people are facing. Talking about what we did in the workshop, so we used divergent thinking. We tried to come up with to understand as many problems as they're facing through the divergent thinking, and ask caregivers to share with us what are the challenges they're facing, and what are the without asking them to clarify if these are real challenges or prioritize them, right? So the first phase was all about exploring all the problems. And so we came up with a list of 13 different problems that some of them were definitely we were not aware of. For example, how they keep person with dementia safe. That was one of the central point of the conversation. So after we came up with these lists, so talking about design thinking process, the next step is to define what is that specific problem that we are addressing, because of course, considering the resources and time we have, we cannot focus on all of these. So then the goal of the workshop was to find a way to, like we asked caregivers to narrow down this list to one central key problem. And so we tried to give them some criteria, for example, if the solution exists, if the problem is not as critical, and just different ways for them to think about what is the priority or what are these challenges, which of them need urgent attention, I would say. So again, we use convergent thinking. So that means that we really try to ask them to just eliminate some of these problems and then focus on one central problem. And then so we came up with this central problem of diagnosis is a critical time. It's a vulnerable period. And we took it from there to, after this stage, we started to explore different intervention or solution that can be appropriate for this central problem. So talking about next stages of design thinking, ideate and prototyping are really central. It's very important to start exploring the intervention and what can be potentially the solution. So really we're trying to find out how we can address the need or central problem. And then how we can come up with an intervention that is creative, that is innovative, that truly meet the need of the patients and family caregivers. So in the previous workshop, we... Excuse me, sorry. So in the previous workshop, let me know if I'm talking too fast. In the previous workshop, we defined the central specific problem statement, which was post-diagnosis of vulnerable period for caregivers and persons with dementia. So then we defined our goal. So the goal for us is to provide better help at the time of this critical time, right, initial diagnosis. And so the question that we asked for the next step was, what type of intervention can potentially support caregivers during this critical time? Again, we started with divergent thinking. So again, the idea is to, without any judgment, just come up with as many interventions as possible. So what are the solutions to this central problem? And of course, with caregivers, so they were, throughout this process, they were key person, I would say, to help with defining problem, solution, everything. So they help us to come up with 14 different intervention solutions that can be addressed in the future through the integrated clinic or other I would say, basically, we defined all these interventions that each can create a research agenda. And then the next stage is a test or evaluating basically, or assessing what is, which of these intervention is the best, or which of the solution would best provide, support caregivers with the problem they have. And so again, so we had this list of 14 different solutions. So what we did was we had this conversation and brainstorming among caregivers, of course, but also clinician were also involved, right? If they had any idea, of course, they were welcome to share their idea. So we came up with this central key intervention that is all about how we can improve or provide a universal care in the post-diagnosis time, or how we can provide a more comprehensive person-centered care. So they have access, basically, the idea was how they can access to different care that they needed at different level during that time. So that is what they found to be most critical. And then really these central, they proposed this central key intervention or idea or solution to be focused on for future studies. So what we did also, like any other study, we tried to understand if these workshops were helpful for researchers. By the way, I think I forgot to mention, but in each workshop, we had up to 34 participants attended, researchers, different level, and so it was a pleasure working with them. So we sent them a pre and post survey to kind of, which helped us to understand if the workshop was helpful. And I want to just focus on one outcome of the survey, which was interesting. So there was this key question of what is the main challenge, in your opinion, in caregiving that you're trying to address in your intervention. And it was interesting to see that in all the pre-survey responses that we received, I would say all the answers were pretty generic. It was based on assumptions, and sometimes very general, not specific. And then in post-survey, all the answers that we received was much more, applied to the real need and comprehensive, and basically showed the real understanding of problems that caregivers are dealing with on an everyday basis. For example, so in a pre-survey, we got this answer: motivating care providers to perform daily oral hygiene. That was the goal or the idea they had. And then in post-survey, the answer was like importance of streamlining and tailoring care. My research is still focused on improving oral health mastery for caregivers, but I have rethought how to approach it. So there are many answers that basically kind of showed us that, similar to this, that they try to really back up all the assumptions that they have with real understanding of the caregiver's need, as it should in the post-survey. And so in conclusion, I would say design thinking contributed to dementia care and help us to understand the intervention in the best solution in different ways, right? So first of all, I would divide it to two central key contributions. So it helped us to explore problem space in dementia caregiving, and it helped us to explore solution space more in depth for dementia caregiving. Talking about the problem space, it specifically created awareness among researchers and provided more concrete perspective. That is an assumption about caregivers' real challenges. So it helped us to identify a list of unknown or hidden challenges, the priorities and urgent matters. What are the problems? Which of them need basically urgent care? And through empathizing, of course, with caregivers. And then talking about the solution space, so it helps us to identify a list of intervention that each can be developed as a full research agenda, excuse me, program. And then as well, it was interesting that for integrated memory care clinic, the clinician kind of acknowledged these all these problems, and they decided to, working on how to address these and how to apply these, in their, to create more patient-centered care in the integrated memory care. So it was it helped them as well to focus on real needs and, think about how they can improve the clinic, through this design thinking approach. Yeah, so these are just a list of references. I just wanted to mention here that design thinking materials are openly accessible through Stanford University's design school, which basically has granted permission for their content to be used. So I just added the reference here, and that I encourage you to have a look and see what materials they have if you are interested in applying a similar process to your project. With that, thank you very much for your attention and your time, and that's pretty much what I wanted to share with you today. And I welcome any question.
Leila, thank you very much. Any comments or questions? So I was part of it, but sort of the silent part of the 3-part webinar that you led. And I thought one of the questions I have is around the empathize stage, the first stage. And the question is, how do you choose the consumers? What principles do you use to choose the consumers to be part of that empathy exercise?
That's a very good question, Ken. It's different I would say, with design thinking, it's the good thing about this process is that it's very flexible. We can be creative. I personally would like to always involve participants from different backgrounds or all the stakeholders. If we want to, for example, focus on or come up with more comprehensive solution, perhaps is a great idea to invite clinicians, patients, caregivers, so on and so forth. But again, depending on what we're looking for, right? So for example, for the project that we were focusing on, really the goal was to understand, focus on the specific need of caregivers, because that's an area, it's there for 40 years. I mean, there are different researchers on that, but I believe there are many assumptions and on what are the problems, but there is no clear, perhaps, understanding of what can be done or what are the true needs. So that's why we focused on just caregivers, but it can be expanded and we can invite, different stakeholder to have a better, more comprehensive understanding of the problem.
One of the things I thought was so interesting was that in the very first design studio webinar, there were only one or two or maybe three caregivers, and one of them was very dominant and had a very strong agenda, almost an advocacy agenda. And I felt it could have overwhelmed the conversation. And in the subsequent studios, more caregivers were brought in. And so I guess I asked you essentially a loaded question, because I thought one of the things that I would want to do in the future is to select people who are going to give me answers I didn't expect. Whereas I thought with one of these participants, I was getting the answer I fully expected. And so how careful, therefore, again, back to my question, does one have to be in creating an empathy group?
Again, that's a great question. I would say one, like the most, perhaps the easiest answer would be like, okay, if we have this random selection of a target group that we want to work with, really the question is that maybe the challenge for us is to come up with questions that are very specific, and second, to make sure that we facilitate the session in a way that make sure that everyone share their opinion. It's very much similar to focus group, the way we conducted design thinking. It can be done through more hands-on activities, I would say, more individual. It can be merged with participatory approaches if you want to. Again, as mentioned, in empathize phase, there are different ways to basically collect data. If we do more the way we did, right, through conversations, which perhaps is still the best approach, I would say facilitating that conversation is important. But talking about also screening participants, maybe we can have some criteria, define some criteria, and if they are for inclusion, exclusion. I don't think if I have a better answer for that, to that question. Ken, sorry. It's
simply, I think, a caution that those, this is such a really rich and wonderful approach. Yeah. I think it's a caution. Irene, you have something?
Yeah, first of all, I wanted to share that I was part of the design studios. And if you all couldn't tell, those oral things were mine. And I found,
you're okay with saying that.
I found the process so helpful. And I wanted to share an example of this where it really kind of like hit me. It was one of the studios, and there was, Ken, I don't know if you remember this, but there was chat going on, like not verbal chat, but in the chat. And I think I put in some idea. It didn't have anything to do with oral health. It was just a caregiver intervention idea about using a texting app and AI. And Ken encouraged me to voice that, like verbally, and I did. And there had been some positive chat from researchers, but I was really struck by what happened when it came out to the larger group, and the caregivers were just, they were not interested in it at all, even though I thought it was a fantastic idea. And and there were researchers in the chat that thought it was a fantastic idea. So that was like, that was kind of a little bit of an aha moment for me. But I did want to address what Ken was sharing, because I did notice that about the caregivers, that they were very kind of articulate, involved, maybe not the most representative of who I would want to be talking to and hearing from. So like, I like that idea of like thinking about how do you screen for people who are involved in the design thinking process. And then your idea about different ways to communicate. So maybe this verbal Zoom might not be the best way. Maybe having exercises where, like, I don't know, you chat or you break out or something like that would be another way. Absolutely. But I love the process. I thought it, and it was just really, I wish all research processes were like that, because it's so, and there's so many ideas that just, when you have that conversation that's happening with different people's minds and experience that converge, like there's just this synergistic effect, which is really exciting.
Yeah, thank you. Thanks for sharing your experience.
Yeah, I found it. Leila and I are now taking part in another design studio with people living with mild cognitive impairment and their care partners. And I'm finding it a really humbling experience in that, just as you did, Irene, you have this idea as a researcher, here's a terrific idea, and you put it out there and you get this sort of, that's not very interesting at all.
Yeah.
But wait, that was a brilliant idea.
Yeah.
And so for those of us who, like me, carry around, you know, a sort of hammer that I'm looking for a nail, that takes that hammer out of the hands, and you know, what is really out there for people. It's fascinating.
Yeah. It was interesting that one caregiver, she kept mentioning that, like, we proposed ideas and came up with solutions, etc., as we discussed, right? And she was like, no, like, and if you don't know about it, ask me. I remember that she mentioned it several times, and I was like, yeah, very true. But I think they also enjoyed the process. I mean, they found it, not only enjoyed, but they found it helpful or interesting that we do care about all those specific problems that are not, perhaps from the point of view of us, is not as urgent or important, but just paying attention and trying to extract all those information and all those nuances and all those problems that are not, in our view, are not as important. I think it was, perhaps they were also excited to share it with us. Really, we also observed great engagement from caregivers, which was great.
Can you talk about how you bring about convergence? Because, you know, as you pointed out, there were more than a dozen problems suggested, and then at the end there are more than a dozen solutions, and yet you arrived at a problem to solve, and you arrived at a solution. What do you think are the key elements in bringing about that convergence?
That's a great question. You remember, as we were planning for the workshop, we discussed how to do it. And then when we conducted the workshop, it was very difficult to ask them to eliminate some of the problems. I would say one way that at that time for this workshop one solution was like giving them some criteria to start thinking about, right? To give them some very much, solution to how to narrow down the list. But I would say it's really important to have conversation and like have everyone's, because that was a collective, the outcome was, you know, like multiple caregivers were involved, and they discussed if this is something that perhaps we need to focus on. And I saw that as an important factor, and it was really helpful when they started having that conversation, as if this is something that you experienced and I experienced, and so is a problem of all of us. Otherwise, if you do it individually, you know, they had perhaps slightly different opinion. but that collective thought or collective process of let's see what is the priority, I think was interesting to see. Again, I mean, there are different ways, I mean, depending on the project, but it's really important to find a way to, or give them a toolkit to narrow down, to help with convergence thinking, convergence and convergent thinking. So we can be creative. I mean, there is no, yeah, it's not rocket science, or it's not something that you're all familiar with, different way of thinking. And but I assume if we do it in person, like a workshop, right? After pandemic, hopefully one day we can have it. There are many ways to do hands-on thinking and hands-on creations, and you know, we can create cards and they can sort the cards, and you know, thinking with hand is something that we believe in it in design, and that help them to have the conversation, but also like play with all this stuff to help them with prioritizing perhaps the solutions, or picking one solutions.
One of the things that you started out by saying is that design thinking is a collaborative process, and I thought that the milieu that you created was one in which people really felt collaborative, that they were part of something, and that they were not on display, they were not performing, but they were really working together with those of us who were sort of researchers and clinicians, so that there was a kind of a breakdown of what I might think of as hierarchical barriers or something like that. Is that something that you have in mind when you're doing this? Or
definitely. I mean, some of these, if we talk about design thinking, one of the most critical, I would say, stage is ideation. And in ideation, we can use different techniques such as brainstorming. And brainstorming is the one that there are some really criteria in terms of how to do a brainstorming, right? And the most important one is that it should be a group working together. It's collaborative. And then I would say, then you go together, you go through this process of convergent thinking and divergent thinking, no judgment. So all ideas are welcome, and things like that. So that is what I would say was helpful for me to think about what approach or how to conduct these sessions in general, having that in mind, that is collaborative. So there is, like in design thinking, if there's no collaboration, there's no innovative outcome, because as you brainstorm together, you can kind of, something that you don't see someone else, you know, see it as a problem, right? And that collaboration and collective thoughts, I would say, is the most important thing. So, and looking at the same problem from different point of views and different perspectives, and help each other to come up with a truly, you know, with an intervention that worth focusing on, or worth developing further.
If I focus on the latter part of the model, the prototype and test part, I'm not sure how to ask this question, but is the expectation that the test is going to prove that it's right, or is there some sort of a circular design to this, that you prototype and you test and then you go back and re-emphasize?
Absolutely.
How does that work?
I'm glad you brought this up, because I don't know if I emphasized on the importance of iteration enough in the in the slides. So while we introduce it usually as a linear process, design thinking with 5 steps, but the most critical, I would say again, criteria in conducting a successful design thinking is go back and revisit any of these stages as needed. So we follow all this process and test it, right? So we come up with this intervention and get some feedback from, for example, caregivers, and depending on the type of feedback we receive, we may need to revisit any of these stages. We may go back all the way to empathize. If they say, no, I don't think this is something that I shared with you as a central, if this is not associated, let's say, with the problem that I have, oh, okay, so we got the problem completely wrong. And so we have to go all the way to the beginning of the process to revisit the problem. If it's all about we come up with a solution, intervention, and it's more about the specification of how, for example, we run the clinic, and they said, no, maybe you, I don't know, through this kind of care, we would be happy to, receive this kind of care. And so it's all about solution. We may want to revisit the ideation or prototyping, so more applied to interventions. So if we think about it as a problem identification and solution identification, we may need to revisit any of these stages. So that's very important. So it won't be ended. We don't stop necessarily at the testing phase.
I think that's just critically important for all of us who are involved in any kind of intervention development research. And I can say that in the Roybal Center pilots and all of the pilots that we're putting on, we urge the investigator, and that we're supporting, we urge the investigators always to have some kind of a formative evaluation component, not only measure the outcomes in some quantitative way, but return to the consumers and basically ask the question, was that the right solution? Did we have the right question, and was that the right solution? And I think, whether it's an R21 or an R01 or a K award, or any of those investigations in which our faculty are involved, that ongoing linkage with the consumer, with the end users, is such an important part, I think, of the design thinking process that you're sharing here.
Absolutely.
Leila, can I ask, how does design thinking work when the work you're trying to do is further upstream from the end user? So maybe it's not intervention development yet. It's like maybe more mechanistic. Could you describe what that would look like?
So would be helpful if you give me an example, Harry.
So I'm thinking about my work, and say I'm interested in just like the biology of something. Yeah. Like, what is the reason behind the relationship between oral health and Alzheimer's disease?
That's a great question. I'm really trying to think if that is, sometimes you really want to, I would say, if what you're doing is more fine-tuning, or sometimes you need to simply conduct a quantitative study, right? If you're looking for a specific correlation, etc. But I would say in general, design thinking help to come up with an innovative solution, and you don't need to necessarily the outcome, right? So won't be, because the way we, for example, designers do it, follow this process, right? We usually have at the end something physical at hand, right? So a tangible product. But that's not the goal of design thinking. If you want to come up with innovative solution of any sort, you can still tweak the process a little bit, and make sure you use specific techniques that would be appropriate for your project, and still use it as a way to help with better thinking, I would say. You know, the goal is, they call it creative problem solving. That means that whatever you come up with is creative, is different, it's new, and it's truly meets the central need that you define. So again, I'd be happy to talk more after the session or anytime to perhaps brainstorm more what can be done. But I would say is a very flexible tool. Definitely can be used for different types of problem, not necessarily design problems. That's why it's something that we use in outside the area of design. And in design thinking, they focus on prototyping, not final product, and that they define it as any type of intervention or solution. I hope it helps, but in general, it's very, very flexible approach. As far as we kind of follow these steps, they believe that, like, there are many studies basically in Stanford University that show that if you follow these steps, the outcome is innovative, is different, is unique. But you can reappropriate the process for your project.
So in the NIH stage model of intervention development, there's a stage 0, which is a basic science stage, I mean, that I think is where you're talking. And it's sort of between the stage 1A, which is kind of intervention design. Mm-hmm. We had a speaker yesterday, Dr. Talisa Spikes. I think this might be an interesting example. Who's looking at issue of cardiovascular disease in African-American women. And she's looking on in both directions. One is, are there interventions to improve that condition or situation? And the other is, are there underlying mechanisms, which I think is, Irene, is where you're at too. And, just thinking about her talk, which I thought was fabulous, where I could see the design thinking being useful here would be her kind of continuing to involve her consumer group, if you will, her end user group, in sort of this empathy business as a way of almost stimulating her thinking about mechanism. I don't think you wouldn't anticipate that any consumer group would say, I think inflammation is my problem, but I think just the conversation may drive one to think about, maybe I should look at this mechanism or that mechanism. So I would anticipate that the conversations in the empathy and ideation phases might not lead directly to mechanism, but might stimulate thoughts about mechanism.
I think so.
Yeah, that seems like an important principle, that even if it's further upstream, that somehow involvement and conversation with the community that you're trying to affect is important. You know what strikes me when I hear you talking is, like, that whole design process for me, it really resonates. Like, it just makes sense that that's how researchers should think and work. But it's so different from the way I was trained. I was trained to think very individually, like, come up with my idea, look at the literature, come up with your idea, and then, yeah, you find collaborators to fill in the holes where you think you have gaps. But we're not trained to do that design thinking process, which I think requires some training and practice, because it's not always instinctive to be empathetic, not just with the end user, but with your team. So that's just a thought I had.
So I want to, that's a great point, because I, as a researcher, right, so because I do a lot of design research, and we do everything that you talked about, literature review to define problem, and then all these concrete qualitative or quantitative research methods, you know, to come up with, you know, when you write a paper or publish, right? So you need to follow design, like research, you know, apply research methods properly. But what design thinking can be helpful is in the, I would say specifically in problems that perhaps are complex. So it's very helpful for complex problem. They call it in the literature wicked problems. So the one that are so, like, for example, I don't know, global warming, or that there are different criteria involved, or it's so complex that by reading literature, or, you know, you cannot necessarily, or it's new, right? It's a problem that is new, there is no literature on, and you can't find much information about the problem, which is I believe is the case with caregiving mastery. So we have all these researchers. Of course, it's not a new, I would say, research area, but the assumptions are perhaps not super accurate because of different level of complexity that this problem, you know, that they're facing. So I think design thinking help better with, again, is a creative problem solving, where it's kind of help for not only come up with innovative intervention, but to help us understand more complex problems, I would say. That's how that the best can help. And I see that many of the issues, especially in healthcare, are complex problems. And empathy is important, and we can use different, of course, research methods to fine-tune everything and to kind of be complementary with design thinking. But so I don't see it as a substitute to everything, the other things that you're doing, but as a complementary approach to make sure that you have a good understanding, and whatever you propose of the problem, and whatever you propose is creative, and then applied directly help with resolving that problem. So it's kind of different. And again, that collaboration is key, because that way we make sure that we're not just looking at the problem from our point of view only. So.
This has been great. Thank you so much. I think really.
Thanks for inviting me. It's a pleasure.
And if anyone wants to contact Dr. Aflatoony, I can provide a contact. But
yeah. So do you have my email address? I think in the ad. I'm not sure if you have my email address, but I can send it here in the chat. Mm-hmm. If I can just find the chat, yes.
I was tempted to ask you what things have you designed? You designed chairs and gadgets, or?
That's a good question. More technological tools, because my PhD is in interaction design or human-computer interaction. So I do a lot of qualitative study to understand, again, what type of technology would best help this problem. And sometimes we do even study on an existing technology, I don't know, which is sometimes they're new, for example, voice-based system for aging population, right? So one of my former students focused on that. We recently developed an augmented reality for occupational therapists to help them with assessing the home environment for people with disability, and help them to choose assistive technologies. Yeah, so either we develop something, but usually we also do concrete qualitative and sometimes quantitative study to understand the need, and conduct usability testing to see if the tool is something is useful and usable for people and things like that.
Well, again, thank you. And everybody should remember that Dr. Aflatoony is just across town.
Absolutely. I'd be happy
Catherine, do you have
to connect.
A great discussion. Thank you.
Well, thank you, Catherine. It's a pleasure. Thanks for having me, and thank you so much for your time. Please, again, feel free to contact me if there's anything that you think I can help with, or any collaboration, let's say that way, would be great. So I'd be happy to be involved in any project that you think I would be can be of help. Any help.
Thanks very much, and
thank you.
Thanks to everybody for attending. Kathy, do you have something?
No, I was just going to say thank you so much. I didn't even know this was an option, so it's great to hear about how it works and know that we can incorporate you in future work and intervention planning. It's just a great resource. Thank you.
Thank you. Thank you. Again, it's a pleasure.
Thanks, everybody. Have a good afternoon.
Thank you. Bye, everyone.
Hey, Jeff. Jessica?